And joining me in the studio to discuss this is Dr. Nseabasi Ekanem. Welcome to TVC News.
Thank you very much.
Yes, the Center for Disease Control says 5 tests have been negative, and we heard about the measures by the Ministry of Health. But then again, how is that proactive enough? Because some would say other countries have stopped all arrivals from China completely.
Well, I would say that the current quarantine process or procedure is good, but I think we may need to do much more. People coming from the South Asian countries, I think as much as possible should be properly quarantined. We could remember what happened in Ebola case, where we had Patrick Soya who came in, all the way from Liberia. We need to make sure that these people are safe so that they do not transmit this virus to others. And that means that we must strengthen our quarantine procedures. As a matter of fact, if possible, people who come in should come with the details of their transaction and their movement in the Southeastern Asia, particularly those that are coming from the endemic areas in China. As much as possible, though we might not be able to, at this point, stop people from traveling there, but unnecessary trips to China must be curtailed, at least until we are able to find a solution to this. Right now, it's in Egypt. It is no longer a question of if it will come to Nigeria. It is when it comes to Nigeria, what is the procedure we have on ground to make sure we can respond adequately to the case. So we must be able to strengthen the quarantine service at all the ports of entry into Nigeria.
I'm glad you talked about Patrick Soya and strengthening the quarantine system.
Yes.
But they say that this coronavirus, if an individual is infected, it takes 2 weeks for it to manifest. So you are saying it's not a matter of if, but when it comes. How do we then protect health officials from becoming infected, as the late Dr. Adadevo?
Okay, so in terms of that, we must ensure that at this point, in all our healthcare facilities, all our doctors, nurses, and other healthcare professionals who are taking care of patients must always be on their full PPE. PPE, that's personal protective equipment. The nose mask, the overall, the hand gloves and all. And anybody that has symptoms that are similar, remember, the incubation period of coronavirus is between 2 to 14 days. So anyone that has symptoms like fever, cough, sore throat, and difficulty breathing, we should first of all ensure that the person is tested to know that he or she is free. Now, whether or not he or she is free, we must ensure that such persons are quarantined properly, kept in a separate ward from other patients. And any healthcare professional or provider that is attending to such a patient must always be on full PPE. No matter the situation, he or she must be protected so that we will ensure that the patients that are in the same hospital and the healthcare professionals are safe while we take care of the patient.
Just a quick one before we exit that subject now. It takes 2 to 14 days.
Yes.
That's the incubation period.
Exactly.
But does it mean that those who have tested negative now could still test positive?
Yes, that means that within the first 14 days, one who tested negative, all right, would probably test positive. So we must actually wait for that period. And again, within that period, symptoms start manifesting. So for people who probably came into the country and were infected, within that period of time, we expect that symptoms have to start manifesting. Nevertheless, there is a case that was reported where a woman started manifesting the symptoms after 43 days. That means that we should be able to, quarantine these people
for much longer.
Much longer, until we are sure that such persons is not manifesting symptoms and is testing negative. Like the Honorable Minister said, we have 3 laboratories in Nigeria that has the facility to test for coronavirus. We must ensure that anybody coming in, first of all, particularly those that are manifesting the symptoms, are properly screened to be free of coronavirus. Okay. We can't take chances with this. Yes.
One last question before you go. Chinese authorities have been commended for their response to the coronavirus as compared with how they responded to the SARS virus in 2003. But then again, it seems their efforts are not going far enough, with the scale and magnitude of infections and deaths that we're recording now. Why is this?
Yes, the truth is because coronavirus of 2019, the COVID-19, is a novel virus. It's not known to mankind. As we speak now, we do not fully understand the morphology and the genetic makeup of this virus. That means that a lot of things still needs to be learned about the virus. And that is why efforts to curb it is almost becoming difficult. And it will take a long time for us to get a vaccine for it. And of course, as we are now, there is no treatment. So whatever we're doing for the patient is actually supportive care. So the efforts are there, but because the virus is novel, we do not fully understand everything about it. So it might be pretty much difficult for us to be able to contain it. But I think efforts globally is quite great. The WHO is doing quite a lot. And we expect that countries like Nigeria should be prepared so that whenever it comes, we are able and ready to respond.
Absolutely, and we hope that the tests will continue to come out negative.
Thank you.
Thank you, Dr. Ekanem.